Good afternoon, everyone. We will give everyone an additional minute or two to get logged in and settled before we begin our Q&A session surrounding the COVID-19 vaccination. Good afternoon, everyone, and welcome to the University of Maryland Charles Regional Medical Center and Charles County NAACP COVID-19 vaccine webinar. My name is Diota Sweat, and I am the president of the Charles County NAACP. It is a pleasure to be here today. We thank our community partners for their leadership in agreeing that this is a most appropriate and valued conversation. Today, you will hear from a few resident experts around the COVID-19, and this is to address particularly some of the concerns of the Black and Brown community. So I ask that you sit, take notes, ask questions, and hopefully today you will learn something new, and your questions will be answered regarding the vaccination. Without further ado, I would like to introduce our moderator for today, Dr. Evelyn Bryant Ward. Dr. Evelyn Bryant Ward is the Director of Operations for the University of Maryland Charles Regional Medical. Dr. Bryant Ward currently serves on the Governor's Appointed Advisory Board for the Maryland's Health Benefits. She has worked in the healthcare industry for over 30 years in both for-profit and nonprofit world. Dr. Bryant Ward serves as a governor and finance expert for HRSA. Dr. Bryant Ward is active in the community and works to build successful partnerships and collaborations that will create opportunities to have a positive impact for marginalized communities. Dr. Bryant Ward is a veteran of the United States Army and holds a master's and doctorate in business administration, as well as a certification in healthcare management from the Professional Association for Healthcare Office Management. She is a 2020 graduate of Leadership, Southern Maryland. Ladies and gentlemen, it is a pleasure to introduce Dr. Bryant Ward.
Thank you for the introduction, President Sweat. Good afternoon, everyone. As President Sweat mentioned, we are here today to help facilitate the efforts of the NAACP and the many associated sororities, fraternities, and service groups to provide you with information about the COVID-19 vaccine. Our goal today is to provide you with accurate information about the vaccine so that you can make an informed choice about whether to get the vaccine and to share that information with your family and friends as they make their decision. We have two speakers today. First, we will hear from Dr. Richard Cook, President of the Charles County Medical Society. After that, we will hear from Dr. Uchenna Obua, Director of Pharmacy Programs at the University of Maryland Charles Regional Medical Center in La Plata. Afterwards, we will have a Q&A where you will have the opportunity to ask any of your remaining questions. Before we get started, we have a few housekeeping items. This is an interactive webinar, and we want your participation. Please submit written questions at any time during the presentation using the Q&A panel in the lower right of your screen. We will address as many questions as we can during the Q&A session at the end. Don't hesitate to ask questions. Please understand that this is an opportunity to get your questions answered from our resident professionals in the field. Finally, if you experience technical difficulties, post your Q&A in the panel. Now we would like to begin by opening up an anonymous poll for everyone to participate in. When the poll appears on your screen, please indicate your answer. The question is, if you were offered the vaccine right now, would you get it? We'll give everyone a moment to participate. Okay. Thank you to everyone who voted in the poll. We will discuss the results at the end of the webinar. Now let's get started. Dr. Richard Cook has a private practice in Waldorf, where he practices internal medicine and women's health. He currently serves as the official team physician for the Southern Maryland Blue Crabs baseball team, is an associate program member at the University Medical Center, holds a courtesy faculty appointment at the George Washington School of Nursing, and is a physician peer member for the State of Maryland Board of Physicians. Dr. Cook is also the president of Charles County Medical Society and a member of the American Medical Association, the American Association of Physician Executives, the American College of Physicians, and is a diplomat of the American Board of Internal Medicine. Thank you for joining us, Dr. Cook. Dr. Cook, polls show that there is a greater hesitancy among African Americans in particular to getting the COVID-19 vaccine. We understand this history, stemming as it does from a history of racism in medical research that exploited African Americans. As members of our audience consider whether to be vaccinated today, should they be concerned that this history repeated itself in the development of the COVID vaccine? And if not, why not?
Well, thank you everyone for having me today. It is definitely my pleasure to be here. And before we totally dive into that question, I just wanted to make sure we all had some context. And I'll try to be as short and sweet as I can on this context, but I think it helps answer these questions. Right now in the U.S., we have more than 26 million cases of COVID and approximately 446,000 deaths, with current trends showing that we will hit 500,000 deaths by sometime this or next month. And this is all while the ICUs are still very full across the country. We've made it through this third wave over the Christmas season and early January, but it's not over by any stretch. We worry that the next 6 to 14 weeks could be some of the darkest weeks of the pandemic as the more contagious strains or variants spread across our country and the world. So despite the fact that this data from the Department of Health and Human Services tells us there's been about a 20% drop in new cases nationally from the prior week, corresponding declines in hospitalizations, we have to remember, and deaths may take days to weeks to arrive. And we have to remember that these declines are not due to herd immunity or due to the vaccine rollout, etc. We won't see those benefits until a few months from now. But they're mostly due to changes in behaviors, people settling home after the holidays, possibly fears of the new superbugs, fears of reacting to news of hospital beds running out, and of course, good old mitigation factors like wearing masks, social distancing, to name a few. So even if a large number of Americans are vaccinated between now and April, the variants, which are about 40 to 60% more contagious, might be the dominant strains by March and could do still a great deal of harm. So vaccines are rolling out, but very slowly, as we all know. However, we are currently witnessing the biggest vaccination campaign in human history. More than 104 million doses have been given in 66 countries. And I want everyone to remember that. Again, more than 104 million doses have been given in 66 countries. Here in the U.S., we've given roughly about 33.7 million first doses, with about approximately 6 million of those having completed the 2-dose regimen of the messenger RNA vaccines. This approximately equals to vaccinating around 1.3 million people per day. But considering that in the U.S. there's roughly 330 million people, and each person needs 2 doses of this current messenger RNA vaccine, that would mean that at our current rate, it would take approximately 500 days to vaccinate every American. So if we want to reopen our country anytime soon, do it right, do it safely and efficiently as possible. We really need to ramp up our vaccinations. That's not saying we're trying to get you to vaccinate, but those who want to get vaccinated, we need to get to them and do so. And just for context, comparatively to the U.S., Israel, the country of Israel, is doing by far the best, and they've vaccinated well over 50% of their population. And they've, of course, seen cases drop as a result. They got on top of that way before we did, so the vaccinations made a difference. Alaska, in our country, leads the states. They've vaccinated about 17% of the population. Let's go down to Maryland. Maryland, we get about 10,000 vaccine doses daily, and have given out approximately 513,000 of those doses, which puts us around 7 to 8% of our population in a state of roughly 6 million, which is about average when you compare it to the rest of the U.S. Unfortunately, right here in Charles County, it appears that we are next to last, right behind PG County in terms of the proportion of population vaccinated, right around 5.2%. The main reasons for this, specifically in Charles County, are a slow rollout attributed to budget constraints, staffing deficits, capacity limitations, the distribution process, and of course the health department infrastructure just not being up to date with the decades of population overgrowth. So to your question, is African American vaccine hesitancy justified, and should we be concerned that the history of racism in medicine that has specifically and purposely exploited our group, will that repeat itself in the development and distribution process of the COVID vaccine, and why or why not? Well, let's look at the details, and I'll let you decide for yourself. But first, let's just quickly define vaccine hesitancy. It's the reluctance or refusal to be vaccinated or to have one's child vaccinated. So here's some numbers. A Pew Research Center survey in mid-November of 13,000 Americans, all colors, shapes, and sizes, found that 39% said they probably or definitely would not get the vaccine, though about half said they might choose the vaccine after learning more about it, which is, of course, what we're here to do today, just give information, correct information. However, among that same study, African Americans, about 58% told the researchers they plan to decline the vaccine, compared with 39% of whites, 37% of Hispanics, and 17% of Asian Americans. But there's more to that story. Vaccine hesitancy in sheer numbers is actually highest among Republicans, 42%, between the age groups of 30 and 49, 36%, and rural residents, 35%. But this is where it gets even more interesting. 1/3 of essential workers and a whopping 29% of those who work in healthcare have vaccine hesitancy. And the main reason cited is what we're here to talk about today. Worries about side effects, lack of trust in the government to ensure the vaccines are safe and effective, worries that you might get COVID-19 from the vaccine, concerns that the vaccine is too new, concern of the role in politics and the development process, etc. So let's discuss these legitimate concerns. First, we want to make sure everyone knows that the participants that were studied with these vaccines were from a very diverse pool. Hispanics made up 20% of those participating in the Moderna trial and 13% of the Pfizer trial, while African Americans made up 10% of each trial's participants. And this goes along with our makeup in the country. Also, an independent task force found that the effectiveness and safety of the vaccine were observed and consistent across age, gender, race, ethnicity, and even in our seniors. And if this makes you feel good or not, the NMA, National Medical Association, which is the largest organization of African American physicians and their patients, they supported the FDA's granting emergency use authorization for both vaccines. And of course, these vaccines have been authorized all throughout the world. Some have even authorized them before the states did. So is history repeating itself? To answer the other question, not in the development process or the scientific process, but let's look at the distribution process. On our analysis in Maryland, only about 16% of the first vaccine doses went to African Americans. 4.6% went to Latino people. Whites to date have received about 66% of the first doses. African Americans are roughly 1/3 of the population in Maryland, and we're seeing similar patterns nationwide. So I don't think there's been, based on these stats, an exploitation of vaccine development. There definitely seems to appear to have been in the delivery. And these stats are partially on the federal level blamed on how they handled the distribution and how hospitals might not be prioritizing equitable access. And of course, we can't forget good old vaccine hesitancy.
Thank you so much, Dr. Cook. That was a very well and thorough response. You actually covered my next 4 questions. So with your women's health experience, would you advise pregnant and or breastfeeding women to get the vaccine?
Well, that's a very straightforward question. And just to add to the other questions, I do have some other information which is important about data and deaths as well. So if you'd like, we can go back to those questions afterwards as well, but it's up to you. So basically with pregnant females, first, we don't have any data on safety or effectiveness in pregnancy. We will shortly because some of the people in the studies became pregnant. But in general, we don't like to give live vaccines in pregnancy. And the good news is that these messenger RNA vaccines are not live viruses. On the flip side, it's been noted in research that pregnant patients who get COVID-19, the actual infection, they have an increased risk of adverse outcomes like preterm birth. So the recommendation is very specific, and it mainly deals with healthcare workers, which is a very high-risk group. Everyone else, you pretty much should not get the vaccine, but the recommendation is if you are in this high-risk group and you choose to get vaccinated, it is totally up to you. And that's a CDC recommendation.
Thank you. Can you please tell us about the vaccines that are currently available and how they work? For example, what is an mRNA vaccine?
Yes, ma'am. Basically, messenger RNA vaccines carry messages, just like in humans, they carry messages. We have our DNA that gives me my brown hair, brown skin. It gives me type O blood, and that's in our chromosomes, in our DNA. Basically, what the messenger RNA does is take that program or message and delivers it so my body can make my type O blood or my brown black hair, my brown skin. Now, that's what happens with messenger RNA in the human. That takes place in the brain of the cell, which is called the nucleus. However, on the flip side, the Moderna and Pfizer vaccines take messenger RNA, which is, again, the message. It is not DNA, and it actually is the message from the COVID vaccine, which is an RNA vaccine. So it takes the RNA message and brings it into our cell to make a part of the spike protein. So instead of making black hair or O-type blood, it's making the spike protein or the arm of the virus. Once it does that in our cells, after we get vaccinated, our cells make these spike proteins, nothing else, nothing more, and our body recognizes it as a foreign, just like it would in a natural infection, and makes antibodies to it. And so it prepares us for exposure next time, and these vaccines are both 94 and 95% effective.
Thank you. Based upon what you have read and researched, has research shown that the vaccines are effective?
Yes, these vaccines are and have really changed how we view vaccines. They've set the bar, they've raised the bar. Most vaccines don't get anywhere near 94, 95%. But these vaccines are exceptional and they work very well. One thing that people do have to remember is that they do not stop someone from getting infected. They just stop people from getting sick. So that's why we still have to social distance, wash your hands, etc. Mitigate.
Thank you so much, Dr. Cook.
My pleasure.
Let's turn to Dr. Uchima Obua, as the pharmacy director at Charles Regional, has overseen the delivery and vaccines to hundreds of people over the last few weeks. Dr. Uchima Obua earned his doctorate of pharmacy from Massachusetts College of Pharmacy and Health Science. He later completed a postgraduate training at Hallmark Health System, Inc. in Massachusetts. After a few years, he returned to Maryland, where he spent 4 years in investigational oncology at the Johns Hopkins Hospital. Uche left Hopkins to become the director of pharmacy at UMCRMC, where he has led his team for the past 2 years. Uche Uma is adjunct faculty at Eastern Shore and Notre Dame College of Pharmacy. He is a proud member of Kappa Alpha Psi Fraternity, Inc. Dr. Obua, let's start with a series of questions people have about the vaccine. Why do the Moderna and Pfizer vaccines require 2 shots? Is this normal?
Thank you, Dr. Evelyn. Can you guys hear me? So Moderna and Pfizer, they require 2 shots because they have to develop, your body has to develop antibodies to diseases. So it is very normal for vaccines to at least have 2 shots. If you think back to, if you're a parent or if you think back to your younger shots, any tetanus, you normally have 0, 6 months, 12 months, so there's normally 2 to 3 because your body basically, you give it a little bit of the vaccine to recognize, and then you give another a month or 2 apart for it to recognize it again and basically build your immune system for it. So most vaccines, not all, are at least 2 shots, so it's very normal.
Thank you. What side effects can people expect when they get vaccinated?
So that's a two-part answer question. So the first one, so anybody with any regular, normal allergies other than anaphylactic shock, anybody who has to use the EpiPen, 55% will get a flu-like symptom side effect. So anything, fever, tiredness, just similar to if you were sick. Then there's also a local where at the site of your shot, there'll either be a little bit of inflammation, it'll be pain or swelling. That's just normal from any normal shot. Those are the largest side effects. In the hospital itself, we've only saw 10%, but out in the community, there's about 55%, depending on your age, your background, and how many times you've been exposed to things like that. So nothing alarming. Just like I said, I've those things.
Thank you. Are there different vaccines for different people?
Absolutely not. Everybody is getting the same exact vaccine. If I could actually turn this refrigerator right here houses our Moderna and our Pfizer. They are not patient specific. We don't tag them white, black, yellow, or brown. Everybody gets the same exact vaccine. We deliver it downstairs, and as the patients come in, they get it. So, in fact, there is no way, shape, or form we know the demographics of who is getting the vaccine. Everybody's getting the same exact one. The lots were not divided on geographical area. The first round of lots, every single state in the country received the same exact lot.
Thank you. I appreciate that. Should I get the vaccine if I've had COVID?
So everybody should get the vaccine at some point in time. The answer, the second part of the answer is when should you get the vaccine? So you should get the vaccine 14 days after you've finished presenting COVID symptoms, in addition to your time that you had to self-quarantine. So I'm going to say for instance, you started experiencing COVID 10 days ago, you go to the doctor, they diagnose you with COVID. So you were quarantined from anywhere from 7, 10 to 14 days, depending on the recommendation and your exposure, and 14 days after that. So I would say give or take 14 to 18 days, but the key answer is 14 days. But you still should also consult your primary care physician, which they'll give you the same answer, but 14 days is the minimum that I would say wait before getting the COVID vaccine. But yes, everybody, at some point in time, everybody should be getting the COVID vaccine that's going to be exposed to another person.
Thank you so much. I have allergies. Should I get the vaccine?
Yes. I would say there's no ingredient in the vaccine that anybody would be allergic to. So, like I said, most people who have anaphylactic shock, allergies to certain ingredients, those people, I would say, you need to inform the vaccinator and also have your EpiPen on hand. But anybody with normal allergies, they are no more likely to get any allergic reactions than the normal person. So if you do have allergies, like I said, you just need to inform the vaccinator that you have allergies if you do have an EpiPen, but allergies should not limit you from wanting to get the vaccine. I think if you actually have allergies, it should make you want to actually get the vaccine even more than a person who doesn't have allergies, because you may be exposed to something else.
Thank you. So if I get the vaccine, can I stop wearing a mask? Do I need to continue social distancing?
So the only time I would stop wearing my mask is either 1, you're in a room by yourself, 2, you're taking a shower, or 3, you're eating. Other than that, I would still wear it. You have to wear your mask. This is not an invitation as soon as you get your first or second vaccine to just go back out into the environment, because if we do that, we'll see the numbers spike. So my recommendation would be to continue your social distancing, continue your good hand hygiene. We were in a shortage of, hand sanitizer. I went to the dollar store. They have a lot of it. So, go out, get your hand sanitizer. Again, somebody mentioned soap and water is definitely the way to wash your hands. Wear your masks. There's a lot of places that have masks right now. They're very trendy. I don't wear ties anymore. I wear masks to match my shoes now. So I would say get some nice masks, continue wearing them. We will be out of this sometime. It's just not yet.
Thank you. Finally, Dr. Abua, you have been vaccinated. Why do you trust the vaccine? Why did you get the vaccine?
So I would say, I'm going to be very honest here. I was one who had a little hesitation originally, just again because of our past and how quickly it did get passed. And I'm not going to, social media and friends really had me a little leery about it. But honestly, I did get the vaccine. I've had my 2 shots already. I had no side effects whatsoever. I hydrated before getting the vaccine, and I was okay. The reason why I got it is because years ago I was in research. So I've seen the beginning stages of vaccines. I've seen healthy patients. I've seen sick patients who have set aside and said, hey, you know what, even if this vaccine doesn't work, the reason why they did it is for the next person. And that's why I did it. I did it for my family. I did it for my friends. I also did it because, like I said, I showed you we distribute the vaccines right out of my office. There's no way, shape, or form I would be a hypocrite if I was passing out the vaccines and I didn't believe in it. If I didn't believe in the vaccines, I would have to step down for what I'm doing. So I know that vaccines have eradicated many pandemics in the past. I'm glad that we had the technology and the science behind getting out as quickly as we could, because I know that this is going to help. It's not going to cure COVID, but vaccines is going to allow the numbers to go down and for us to be safer. And like I said, one day we can take these masks off and hug each other, because right now you don't even want to hug anybody. So those are the reasons why I got the vaccine. And again, to basically be a poster child for my department, a poster child for my family, a poster child for my friends, and anybody else who looks like me. Because I'm telling you, I know everybody's scared out there to get this vaccine. But I'm living proof. I got the vaccine over a month ago. I had no side effects. I'm here. I still have my 10 fingers and toes. And I'm alive and well.
Thank you so much, Dr. Abua. So before we turn it over to your questions, if you want to be vaccinated and are eligible under the current guidelines, this is where you can register. Now let's get to your questions. We will get to as many questions as we have time for. I'll look and see if there are questions that are similar in nature, and so I'll maybe ask one question. So if your question matches up with one of the questions that I'm asking, that is why we didn't, for the sake of time, answer every individual question. So my first question is for Dr. Uche. Do you have any information in terms of efficacy of the Johnson & Johnson vaccine?
So actually, studies have came out, and actually Johnson & Johnson vaccine, to be plain and simple, the efficacy is 85%. In comparison to the other two that Dr. Cook spoke about today, 94 and 95 were the numbers. I'm just going to say do the math there.
Thank you. Dr. Cook, the governor is wanting schools to open in March. During this study and testing of the vaccine, were children in the test pool?
No, children were not in the test pool. I believe that the age began at 18.
Can you talk about how I can access the vaccine if I live with someone in the high-risk category, but I'm not in the high-risk category myself?
if that's a question.
Dr. Cook, I'm sorry.
Okay. Well, I think you've done a great job of putting up the website for Charles County Health Department. They obviously work in stages, and you find out where you are in the stage. We're in 1C right now. The Charles County Health Department website links to the Maryland Department of Health website, and they're very specific about who is getting vaccinated now and where are all the places you can get vaccinated. One of the big news articles that came out today was that the Biden administration will be giving millions of doses, I think it was February 11th, to the major chain pharmacies around the country and some, mom and pop pharmacies as well. So a lot of information about there, but always go to your local or state website.
Okay. Dr. Abua, why should I get vaccinated if I can still get infected?
Why should you get vaccinated if you still get infected? You should get vaccinated for protection. This will build your immune system. If you actually were infected, your immune system would already recognize some form of the COVID disease. So that's why you should get vaccinated, because you're better protected if you do get infected. I would say if you got infected without being exposed to the vaccine, the outcome would be worse.
Yes, and to piggyback on that, he is right. These vaccines, you can still get infected, but you won't be in the ICU or the hospital. The other thing is we're trying to reach herd immunity, which means you can actually wipe this strain of the virus out. And the other thing that I think we've all seen from the pandemic is we keep on doing the same thing over and over again. Mutations spring up, and the pandemic just gets prolonged and prolonged and prolonged.
Okay. Dr. Cook, this next question is for you. A friend requested I ask this question about contracting COVID from surfaces such as chairs in a doctor's office or clothing. To that end, in the doctor's office, I've seen a bin for clean and dirty pens when signing in. I'm assuming the question is, can you contract COVID from surfaces?
Oh, absolutely. That's one of the first ways we thought the main transmission came from. Now we know it's mainly aerosol, from the air, but that just goes to good old infectious disease precautions, mitigation factors. You got to wash your hands, got to wear masks, you have to use hand sanitizer, et cetera, et cetera. Yes, surfaces can harbor the virus. Different surfaces harbor the virus for different time periods. Your face is a surface. That's why if you do touch something and rub your nose, you can bring it to your face, which can get into your nose and get into your eyes, through your tear ducts. You can inhale it. So yes, not as important as aerosol, but very, very, very important surfaces are.
Thank you so much. Dr. Abua, because Charles County is behind in giving out the vaccine and we don't have enough, does that mean we may be given the J&J vaccine instead of the other two? Are our Black and brown communities being treated unfairly?
The first thing I would address is the Black and brown community are not being treated unfairly. Actually, when you register, when you register per group, it never asks the demographics of the person. It asks for name, your date of birth, and a way of contacting you. That way is blinded. Brandon is Brandon. Brandon can be white, blue, black, or purple. So there's no way, shape, or form that we're handpicking people. So everybody gets the same fair share. I do not think that anybody's being singled out. In addition, the Johnson & Johnson hasn't been approved yet. Currently, what is going on is we are getting whatever supply is available. It's shipped is shipped through the state, and then the state sends it out to each site. Currently I don't know where we are with the Johnson & Johnson, but we do have Pfizer and Moderna. We are on shortage. It's just supply and demand. There's more people who need it and want it than the supply can show. And I mean, honestly, that's how we would want it, because you don't want them to rush. It takes time to do things like this. So I would say at some point in time, the Johnson & Johnson will come out, even though the efficacy is 15% less than 100, it would not get approved unless it was safe and effective. There's things that are actually, I believe, approximately the flu is 40% effective, which should lead you to really feel comfortable that 85, 95, and 94 is well above the threshold of a vaccine that we get every single year. And I'll let Dr. Cook add just in case there's anything I missed.
Yeah, the only thing I would add is that J&J probably won't be ready to March, so we have no choice to get Moderna or Pfizer right now.
Okay. Dr. Brewer, this is for you to piggyback off of the last question. How is it determined which of the two vaccines someone gets?
Supply. So we don't choose who gets what. When your number is called and you register, what is available that day is what you will receive. For your second dose, we do isolate the supply to make sure you get the same thing that you got the first time, the second time. Currently, we're given actually both, Pfizer and Moderna, and like I said, I'm not seeing any different side effects from either of them, and everybody is protected.
Thank you. Dr. Cook, will this change any other part of my DNA long term? I have a real fear of taking something that impacts my DNA versus the more typical vaccine approach of injecting dead virus cells.
No more than a natural infection with COVID would. One of the things we have to make sure we understand is that your DNA is located in the brain of the cell, which I called earlier, the nucleus, and the messenger RNA of our bodies are located in that nucleus as well. The messenger RNA vaccines, which are injected, only go into the body of the cell, which is the cytoplasm, never making it into the nucleus. They get evaporated very quickly. And the message they carry is only of the spike protein. It's a very, very small message that tells our body to make the spike protein, and it never gets into, it's not even made to get in the nucleus. It can barely get into the cell with what we've done with it. So you should not have to worry about this messing with your DNA in the future or now.
Thank you. Dr. Cook, can children get the vaccine?
Children will likely be able to get the vaccine later on, but right now we are not vaccinating children. Maybe Dr. Uchiyama knows of some potentially high-risk children that are getting the vaccine, but I know of none. They are an extremely low-risk group, and that's actually the group that might be getting the vaccines like the J&J vaccine when it comes out, because it's not as effective. And if we have an abundance of supply, we would likely vaccinate them with the lower effective vaccine than the higher effective one.
Dr. Abua, did you want to respond?
No, I agree. Currently, there's no studies or anything that really has reasoning for children to get it at this time, especially because you look at the rates children are being diagnosed with COVID like adults, so they are less likely to contract it. So we don't have any plan on vaccinating children at this time. They're very low on the risk pool, like Dr. Cook said, and we would vaccinate all of the high risk before even looking. And we're a long way from getting everybody that is high risk. So our kids or children at some point, but not yet.
Thank you. Dr. Cook, a lot of people say the vaccine hasn't truly been approved. Can you describe the difference between authorized emergency use of the vaccine versus full FDA approval?
Well, it actually has FDA approval. Think of it as wartime. We're in war right now. In World War II, we made B-52 bombers every minute. And we're in war right now with a pandemic, so we need to speed things along. One of the things we sped along was the bureaucracy. The science has been around for decades, so it's FDA approved. The bureaucracy around the vaccination process was sped up, but not the science. The science is very spot on. So FDA approved, CDC approved, world approved. Australia, they have their own CDC. The UK, they have their own CDC. Germany, Italy, Spain, the Netherlands, I could go on and on. They all have their own CDCs, and they've been approved all over the world. So it's not like we're the only ones that did it. And as I said before, many countries actually authorized these vaccines and got them and started using them before we did, the same exact vaccines. And again, we've vaccinated over 100 million people.
Thank you. Dr. Abua, how many people need to be vaccinated or infected in order to reach herd immunity?
How many people need to be infected or vaccinated? I'm going to leave the percentage to Dr. Cook because he's the numbers guy. But it has to be a large number of our population as a whole that's vaccinated in order to create the herd immunity. So if you think about it as a fraction, it has to be at least a partial or half of the fraction to cover the other half, because the whole definition of herd is basically enough people are vaccinated that you now stop the disease. So we said, we're in the lower percentages where we're nowhere near herd, because that means if 10% are vaccinated, that means 90% are not vaccinated or covered. So we need to go closer to that higher number. But I'm going to leave the percentage to Dr. Cook, but that's how the herd immunity works. It has to be a large amount. Like, for instance, our death rate is way up, so we're never going to have herd immunity from infection. It's more from the vaccines.
Yeah, it's what you'll hear is mostly 70%, but those numbers have gone to 80%, and they fluctuate. And Fauci has even said high 80s before. So one of the things that I say a lot with this pandemic and what you have seen in real time is that things change. But, for the most part, 70, 80-something percent vaccinated is what will get us to herd immunity. And remember, herd immunity is a term that only came from vaccinations. It's not actually done from natural infection. It stems from getting people vaccinated.
Thank you both. Dr. Abua, can people with pre-existing conditions such as cancer or autoimmune diseases get the vaccine? So
this is a very timely question because I received an email from the state last night. So they actually added people, because these people are high-risk cancer patients, immunocompromised, dialysis patients. They're actually now in the 1C category and eligible to now actually register to get their vaccine because they're higher likely than a person that's not immunocompromised to actually be exposed and actually have a negative effect from COVID. So they're actually we're at that stage to actually vaccinate that very patient group.
Okay. So one more question, Dr. Cook. If I'm Should I be concerned that the vaccine may be the opposite of intended for someone who has a lifelong weakened immune system, in the sense that sometimes the flu vaccine side effects can be flu-like symptoms?
I'm sorry, ma'am. My dog's barking exactly when you were asking that question. Would you mind repeating that, please?
Yeah, it says, should I be concerned that the vaccine may do the opposite of intended for someone who has a lifelong weakened immune system?
No, not the opposite of what's intended, just might not be as strong as what's intended. However, we all doctors have these type of patients, not only with weakened immune systems, but patients that we've seen with other vaccines just have a really robust response. And I'm not saying robust in a kind of good way. I mean, they still get immunized, but they just have a lot of muscle aches and flu-like symptoms, and sometimes they're prolonged. And sometimes, they're just very, very sick, way more sick than another person. But it's not anaphylaxis, it's not death, it doesn't put them in the hospital. That's the only thing I tell patients. I just actually had a patient who had chronic Lyme disease, and this patient had muscle aches and body aches for a long period of time and fatigue that were kind of getting better, and then she got the first dose of the vaccine. Didn't put her in anaphylaxis, didn't send her to the hospital. She just had some more Lyme-type symptoms come back, plus a rash, and she said herself that, she wasn't going to get the second vaccine. But again, that's not anaphylaxis. Those are just more pronounced responses in the body. And likely, yes, if you are more immunocompromised, you might not get the same robust response, just like if you were on steroids, you might not get the same robust response.
Thank you. We've received some amazing questions, and for the sake of time, we will send out answers post this event to everyone, so make sure you look out for those responses. I want to thank everyone who submitted questions to make for such an informative discussion about the COVID-19 vaccines. Before we close out our webinar, we would like to raise the same question we did at the beginning of the webinar, so we will open up the polls again. If you were offered the vaccine right now, would you get it? Thank you for participating. I want to talk about the results of the polling. Initially, when we submitted this question, 58% of you said yes, that you would take the vaccine. We're still waiting on the polls to close.
Dr. Ward, while we're waiting for the polls to close, I just wanted to end by just letting everybody know, from my professional experience, it's higher likely for you to contract COVID if you did not get the vaccine. If you're having any doubts, I would say definitely consider getting the vaccine, because you would be protected more than if you did not get the vaccine.
So we have the results, and it shows 56% of you said yes, you would receive the vaccine. But I do want to note that at the beginning of the webinar, when we did the first poll, we had only 70 individuals on the call. At the end, we now have 86, so that could be the variation. Thank you so much for participating. We hope we were able to address some of your questions and concerns. Now I will turn it over to President Sweat to close us out.
Good afternoon again, ladies and gentlemen, and thank you so much for tuning in today. Our responsibility as a civil rights organization is to bring the subject matter experts into one space to allow you to ask questions and get them answered, and I hope that we did just that today. The COVID-19 has been around longer than we would like for it to be. The vaccination is now here. Hopefully, for those that were on the fence, some information was provided here today to help you with making a decision in the best interest of you and your families. Remember to stay safe, social distance, keep washing your hands, let's keep wearing our mask. I want to thank University of Maryland Charles Regional Medical Center for reaching out to the branch and asking that we do this partnership. Thank you, Dr. Ward, Dr. Cook, and Dr. Obua for participating today. Thank you for all of our community organizers and leaders that agreed to join us today, the fraternities and sororities and all like-minded community organizations. Ladies and gentlemen, this is our family, this is our community, and we want to stay safe. There was a question that was asked about the health department. We do have a call in to the health department to hopefully have a similar conversation. If not, we will try to invite them to one of our meetings. But we want to be able to have all questions answered regarding how we get the vaccination and make sure that the vaccination is being distributed in an equitable manner. So again, thank you so very much for joining us today, and we appreciate everything that you do in our communities. Have a good day, and God bless you.
President Sweat, I just want to let everyone know that we started with 58% saying yes. We are at 63% saying yes. So thank you, Dr. Cook and Dr. Abua. Great job.
Yes, our subject matter.
My pleasure.
Wonderful job. So thank you so very much. Thank you.
Thank you for having me. Y'all take care.